Hi, my name's Nicola. I'm one of the support workers that coordinate the ePAQ-PO. So when a patient comes into ePAQ, my role of a support worker is to help them get onto the ePAQ system, onto the computer. If they have any problems logging in, I can log them in. If the voucher codes are incorrect, I can look on the system and get the right voucher code for them. So when they've completed the ePAQ on the computer, then they come to a support worker and we do the height, the weight, the blood pressure, MRSA swabs, check the ASA grade, and then make sure put them in the slot ready for staff nurses to take them. Some patients that when they come up to ePAQ, if they're elderly, they get a bit scared about going on their computer, they don't feel confident enough. We are there to help them through it, and then when they've completed it, they feel quite satisfied and quite happy with themselves that they have been able to do it. So feedback generally is really good. Some of the difficulties in ePAQ are when patients come up that aren't fit for ePAQ. Like we do have people that can't see properly, are on lots of medication, and then they do get a bit disheartened that they've been sent all the way up and they're not suitable for it. That's one of the downsides.
Hi, my name's Liz. I'm a staff nurse in Pre-op. Okay, so when patients have been on the computer, they come to my room and we then go through the questionnaire quite briefly, and I give them the blood tests they may need, any advice they are wanting, and generally go through what they need to do from now until the day of their operation. The general opinion of the patients that we see are really enjoying ePAQ. The ones who are very computer literate love it because they can fly through it. It's very easy to use, and it's easy for the staff nurses as well who aren't so computer literate also. So everybody's happy. To be honest, I really enjoy ePAQ because it's not a book system. You don't know what you're going to go on to that day. It's totally ad hoc, so it can be a busy day, it can be a quite relatively quiet day some days, which those days I don't like. But I really, really do enjoy it when we've got a lot of people coming from clinic and you can see all the different specialities.
Hello, my name's Sue and I'm one of the nurse practitioners in pre-op assessment. So my role within ePAQ is when the staff nurses need some support, I'll go in and I will help them with looking at the more complex patients that maybe we decide needs to have a face-to-face with a nurse practitioner. So a lot of the patients now who are fit and healthy are now coming through ePAQ. So as a nurse practitioner in the clinic, we're now seeing patients that are much more complex. So we are seeing the patients that need a lot of input. This does mean that there's more demands put on us as nurse practitioners, seeing 7 patients a day.
So this is my pre-op assessment. I've done a computer questionnaire which was very good, went through everything very thoroughly, been seen a staff nurse, gone through everything again thoroughly. Just waiting for bloods now and then I'll be able to go. Can't fault any of the staff here, it's just absolutely amazing what they do. Very patient, even when you're not right confident on a computer. But yes, had all my swabs and everything done, and then I was just waiting for an appointment to come in for a day.
Hi, I'm Sarah, lead practitioner at pre-op assessment at the Hallamshire Hospital in Sheffield. We implemented ePAQ about 18 months ago. Since then, the unit has changed completely. We have a lot more patients coming through the unit. The staff have really embraced the change and they've taken on ePAQ. Patients love it. They come one visit, they see a staff nurse, support worker. So we've got the right skills of staff seeing the right patients.